We're going to see Crohn disease. Crohn disease is part of the inflammatory bowel disease. This is transmural inflammation of the gastrointestinal tract in skip lesions. Can go from any part from the mouth to the anus. The most common involved part is the ileum, and the less common is the rectum and colon. The presentation is abdominal pain with bloody or non-bloody diarrhea. Extraintestinal manifestations include the same as for colitis, ulcerative colitis, that is primary sclerosing cholangitis, the uveitis, episcleritis, pyoderma gangrenosum, erythema nodosum. The acute flare will be treated with steroids, IV steroids, and anti-tumor necrosis factor antibodies like infliximab. Sometimes we can also give adalimumab. For remission, we will give the tumor necrosis factor inhibitors, and also for any kind of the complication that has to do with the fissures and fistulas. So the fistula, that in order to maintain the remission of the fistula, we will give tumor necrosis factor inhibitors. These, remember, that can reactivate tuberculosis and also predispose the patient to melanoma. For the acute flare, we will give steroids, and if we want to wean off the patient from steroids, we give 6-mercaptopurine or azathioprine. This also for moderate disease. Moderate disease is fever, weight loss, diarrhea, abdominal pain, etc. And the severe is the patient could be unstable. In Crohn disease, the last resort is to do surgical resection of the part that is involved, and what the patient develops also these strictures. This is not very effective, the treatment of the surgical removal. The patient would have vitamin B12 deficiency, as well as other vitamins that are liposoluble. Here, vitamin B12 is not liposoluble, but the issue is that it is absorbed on the ileum, and the ileum is the most common involved part of the gastrointestinal tract. The patient would have iron deficiency, and so we would have a normal mean corpuscular volume. The patient could have, let's say, complications that are fistula formation, kidney stones, biliary stones, and cholesterol stones, and the histopathological appearance would be cobblestone mucosa, that is edematous mucosa. There would be sting sign. This is just like a sting due to the strictures and then not strictures, etc. And sometimes the patient can get dehydrated, and so this can lead to kidney stones. Kidney stones due to dehydration are due to uric acid, and kidney stones due to the increase in oxalate reabsorption is due to calcium oxalate.